Goeienaand, good evening, fellow South Africans and citizens of the world. And this comment by Dr. Zweli Mkhize, notice Dr. Zweli Mkhize, who is the Minister of Health, cannot go unchallenged. And I'll show you why. As the country faces a health crisis brought on by the coronavirus pandemic, the government is pushing forward with plans to move towards a new national health insurance, or NHI, says Health Minister Dr. Zweli Mkhize, presenting his updated department budget vote in a virtual parliamentary meeting on Thursday, the 23rd of July. Mkhize said that a fundamental condition for growth and development is a healthy and productive population with access to quality and affordable health care. Just remember this. The public health system is in chaos. It's completely collapsed. But listen to what this eminent doctor, the Minister of Health, has to say. You can't make this shit up. Listen. Mkhize said, COVID-19 has illustrated just how important data and information are in managing health decisions. We are pleased that during the past few months, the NHI information system's capacity has been augmented, strengthened, and dramatically improved. The investments made in these improvements will all remain and enhance the capability of the department to manage the health system into the future. Can't believe, does he think we're stupid? Crazy. Anyway, he went on to say, we have established a patient registry through the Department of Health patient registration system in our PHC facilities and hospitals. To date, a total of 51,909,554 patients have been registered. You see, Jacob Zuma, I didn't have a problem with that number, but then I have an education. Mkhize said that his department has also developed a health systems dashboard which will soon go live. Mkhize said, the system will support the government with early warning signs and surveilling hospital infrastructure, alerting us to impending critical mass reach in various areas of our operations and giving us an opportunity to respond before there is a crisis on the ground. Well, wake up call, Dr. Mkhize. Wake up call. The whole public health system is in crisis. Every public hospital in South Africa is in crisis. How flippin' good is your useless piece of shit of a IT program? Complete crap, just like the ANC. Anyway, this idiot went on to say, he's an idiot, went on to say that his department had also prepared a proposal resolving health infrastructure backlogs in preparation for the NHI. Mkhize said, Mkhize lied, I'm going to call it, Mkhize lied. The proposal will also play a significant role in job creation and stimulating economic growth and transformation of the construction sector. These guys are clueless. They're completely clueless. Anyway, let's continue with this clueless shit. He said, we believe that this health infrastructure program will improve public confidence in the public healthcare system, improve the morale of personnel, and better staff retention because of a safer clinical environment. Look, I'm gobsmacked. This guy must be living on planet Saturn or the Mars or something like that. He's certainly not living in South Africa if he's saying that sort of shit. This is crazy. Anyway, he went on to say, and I'm not bullshitting, I didn't make this up, this is what Mkhize actually says. We have now started engaging key stakeholders into the National Treasury and the Development Bank of South Africa to develop strategies to accelerate this program. Mkhize said that before the COVID-19 pandemic, extensive consultations were already underway, even with the private sector, potential investors and provinces. He said, the health infrastructure commitment remains, and COVID-19 has taught us that time waits for no man. If we are to achieve our infrastructure goals, we need to do so and move with speed. Well, I tell you what, a tortoise with a broken leg could move faster than your bloody health department. Look, there are nearly 500,000 people who've been infected now in South Africa with COVID-19. It's completely out of control. This lockdown is a farce. You, Mr. Zweli Mkhize, are a complete idiot. And you know what you can do? You know what you can do? You can go and pog my horn, asshole. Anyway, let's continue. This deluded idiot says, in a June webinar, he noted that the pandemic has tested even the most recognized universal health coverage in nations like the United Kingdom, much of Western Europe, China, and Japan. He said, even the toughest of economies have scuppered in the face of COVID-19. Scuppered? Scuppered in the face of... That doesn't make sense. But then, this is an idiot we're talking to. South Africa already faced huge challenges without the introduction of COVID-19. He went on to say, this genius of a man who has the L factor like the rest of the ANC government, missing in action. This is what Dr. Zweli Mkhize says in conclusion. The realization of the national health insurance has been a road hampered by opposition and a fundamentally flawed system that has been protected by those that benefited from it. Do you see that subtle reference to apartheid? Remember that ambulance scooter? The Minister of Health in Eastern Cape who said, we only bought the scooters because of apartheid. Blame it on apartheid. I mean, this is the crap that goes on in government. Anyway, Mkhize went on to say, although the annual budgets of the private and public sectors are similar, the private sector only serves 16%, while the public sector serves 84%. Well, guess what, Minister Mkhize? That's because your ANC government are so incompetent and so incredibly corrupt. He concluded by saying, with such inequality, the public health care system has suffered in the sheer weight of the burden, while the private sector was characterized by over-servicing in the face of rising and escalating healthcare costs. This is the health ministry in South Africa. And the guy who's just been talking is the Minister of Health, Dr. Zweli Mkhize. If it wasn't for Becky Cele, I'd say he's running close second as the nominee for Hlari Motsoeneng. But no one can beat Becky Cele. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe. Bye for now.